Hello, class. In this session, we're going to be talking about cancer prevention. That is chapter 11 of the course textbook. Let's begin. Learning objectives. By the end of this module, you should be able to define cancer and understand how it starts and spreads, identify major risk factors that lead to specific types of cancer, assess your risk for developing certain types of cancer, list everyday lifestyle strategies that you can implement immediately to decrease overall cancer risk. What is cancer and how does it start? What is cancer? When you hear the word cancer, there is often so much misinformation out there to understand what it is. Cancer is defined as a group of diseases characterized by uncontrolled cell growth and the ability of these cells to invade and spread to other parts of the body. Cancer is not something you get from something outside of your body. Cancer develops within your body and is the uncontrolled cell growth within your body and the ability of those cells that are growing within you to invade and spread and take on the nutrients and resources needed by other cells in your body. Normal cell growth takes place to repair and replace all worn out tissue. Yes, your body repairs and replaces all worn out tissues. Often this takes place when you're sleeping. That is why it's so important that sleep enough to allow your body healing, repairing, and complete all these processes. This repair and replace of all worn out tissue is controlled by the deoxyribonucleic acid or DNA and the ribonucleic acid or RNA found in the nucleus of each cell. DNA is what makes up your genes. Cells duplicate or divide, usually duplicating DNA perfectly. Every cell in your body, every time it duplicates the exact same DNA for which every cell in your body is made of. However, when an error is made, enzymes, when your body is functioning correctly, can fix the problem. However, if the error is not corrected, then it results in an abnormal cell growth. These cells start to replicate and duplicate without anything being able to control it or prevent it in your body. Now, many times you have heard the importance of early detection because with early detection, sometimes you may be able to remove those abnormal cell growth before they spread to other parts of your body. When an abnormal cell divides without being repaired, typically sends an instructor to carry out programmed cell death, called PCD. If that does not happen, it's when abnormal cells continue to divide and pass on the defective DNA. And here's an example of normal versus cancer cell division. On the normal side, you see how these cells start to duplicate. However, when there is a mutation, your body's programmed cell death process kills or destroys the abnormal cell. However, when there is not the ability to stop or destroy the error on the mutated cell, then they start to duplicate, and that is when cancer occurs. DNA mutations. Key genes within abnormal cells may then facilitate cancer development. Proto-oncogenes control cell types and frequency. Tumor suppressor genes are the ones who slow the cell growth. However, oncogenes are the ones who speed up cell growth. And it is those oncogenes the ones that make possible for the cancer cells to replicate at faster pace. Tumor formation. Tumors develop when abnormal cell growth or multiplication uncontrollably occurs. It is that amount of abnormal cells growing that create this thing we call tumors. And there's two types of tumors: benign or malignant. Benign are tumor formations that do not carry any cancerous cells within them. Sometimes that happens. Sometimes there's a normal cell growth in your body, but not necessarily means that it's cancerous. However, malignant tumors are the ones who carry cancerous cells, and those are the ones who can become problematic. If not detected early, they can then metastasize, and metastasize simply means that those cancer cells have left the site where they were growing abnormally to other parts of your body and start to replicate in those other areas of your body. How cancer starts and spreads. The following graphic shows you how cancer starts. We have an abnormal cell growing without control. Those abnormal cells start to growing and multiply. But then when they multiply and grow exponentially, then they start to touch the blood vessels and lymph vessels. And once they get to the blood vessels and lymph vessels is when they start to spread to other parts of your body, and then they start to grow in other areas of your body. Remember that the cancer cells are growing within your body. You don't acquire them from somebody else. Nobody's going to pass it to you. This abnormal cell growth is occurring inside your body by your own body functions. Okay? What causes abnormal cancer cells to develop? The following graph shows you the major cancer sites or the most occurring cancer occurrences, and as a result, death because of cancer in the United States. Lung cancer is the highest in terms of death rates for major cancer sites in the country, particularly because if it is associated with the use of tobacco products. Cigarette usage, smoking are leading causes of why this type of cancer occurs. Then that's followed by colorectal cancer, then breast cancer, then pancreatic cancer, then prostate cancer, then leukemia, and then esophageal cancers, and then ovarian cancer. But as you can see by the graphic, lung cancer is the highest in terms of incidence of cancer in the country, again because of the use of tobacco-based products, smoking, and stuff along those lines. Genetic versus environmental factors. There's many risk factors for cancer. Unfortunately, one of the main risks for cancer is genetics. When you have a history of cancer within your family, then you have a higher risk for developing cancer because the gene that carries the information for cancer is within your genetic makeup. But there's also environmental factors. Some of those environmental factors are the use of chemicals, substances, alcohol, cigarette usage. Those are environmental factors because you're adding environmental toxins to your body. But also polluted water, polluted air conditions. Any time your environment is toxic, it will have an effect on your health. Then there's the notion of epigenetics, how those environmental choices change the way genes work, and certain genes can be turned on and off by our lifestyle choices. And our genes are passed down to our children, and those children carry the genetic makeup of their family history. So this cancer risk has multiple factors, not just one single factor, from genetic components to environmental factors to epigenetics. Major cancer causing factors. Again, tobacco use, smoking, including vaping, still have the highest percent in terms of leading cause for cancer, followed by excess body weight, alcohol consumption, poor nutrition, and physical inactivity. If you notice, all those are lifestyle choices. So we may be able to reduce the risk for certain types of cancer if we eat better, if we don't use tobacco products or don't smoke, if we don't consume alcohol excessively, but also if we are physically active. So most of the factors leading to increasing our risk for developing cancer are lifestyle choices. Cancer prevention through a healthy lifestyle. Top 12 recommendation for cancer prevention. The first recommendation for preventing the risk of cancer is to achieve and maintain a healthy body weight. The reality is that overweight and obesity put your body at risk for many chronic conditions, including cancer. Second, adopt a physically active lifestyle. You don't have to exercise or play sports, but the fact that if you just start being active, it will have an immediate effect on your health. And the more physically active you are, the lower risk for cancer, but also the lower risk for developing other type of chronic conditions. Adopt a healthy diet, eat better, consume more vegetables, consume more fruits, reduce the amount of sugar in your diet. Limit alcohol consumption because alcohol is an external substance you add into your body. Therefore, it might increase the risk for certain types of cancers, specific colon and pancreatic cancer. Do not use tobacco in any form. No cigarette smoking, no vaping. And the reason is that these chemicals that are in the tobacco product can increase your risk for developing lung cancer. Avoid exposure to occupational hazards. Practice safe sun exposure to reduce the risk for skin cancer. Limit the consumption of processed, charred, or well-done meats. Have your home periodically tested for radon. Have your home periodically tested for arsenic. Be aware of outdoor and indoor air quality. And lastly, ask your doctor the right questions about medical imaging tests, specifically for older adults who are at higher risk for developing cancer. What to eat for cancer prevention? While we can read and find many recommendations, the reality is that is when you have a balanced diet, you reduce your risk for many types of disease, for many types of chronic conditions. Certainly, the more fruits, vegetables, and legumes you have in your diet, the more phytochemicals, the more antioxidants, and the more good stuff you get into your body. Tea is another form of adding antioxidants to your body if you don't want to eat fruits and vegetables. Vitamin D, fiber, and calcium, monounsaturated fats, and omega-3 fats have been shown to be preventive in developing some forms of cancer. Keep in mind that nutrition is just part of the equation to reduce your risk of cancer. What foods to avoid to minimize or reduce your risk for cancer? You want to reduce the consumption of processed meats and highly saturated proteins. Okay? You also want to lower the consumption of sugar in your diet. And then you also want to lower the consumption of alcohol. We're not saying you don't have to eat sugars. We're not saying you don't have to consume alcohol. But it's in the amounts that you do. Anything in excess will always result in negative consequences for your health. Avoiding excessive sun exposure. Sun exposure is good for your body, but excessive sun exposure can have detrimental effects on your health. Excessive UV exposure is a major contributor to skin cancer. How physical activity helps prevent cancer. Now, physical activity will not cure you from cancer, but physical activity will reduce your risk for developing cancer. So, physical activity is a preventive measure for developing chronic conditions. And how physical activity lowers the cancer risk is because it helps individuals maintain a healthy weight. It also helps balance hormones. It helps support healthy digestion, reducing inflammation, but most importantly, physical activity boosts your immune system, enabling your body to fight back. Therefore, being physically active decreases your risk for cancer for both men and women. Early detection and warning signs. Prevent or control through early detection. Early detection is often preferable for individuals who have high risk of cancer because the early any type of tumor is detected, the better chances for the person to recover from cancer. Specifically for breast and testicular cancer, self-examination and regular visits to the doctors are recommended, specifically when you're doing your wellness checks. There's 9 warning signs. Anytime you see changes in your bowel or bladder habits, sores that do not heal, unusual bleeding or discharge, and the thickening or lump in breast or elsewhere. Indigestion or difficulty in swallowing, obvious changes in wart or moles, nagging cough or hoarseness, unexplained weight loss, and ongoing pain or fatigue. These are warning signs, okay? Experiential learning 10. As a way to help you assess your risk for cancer, you're going to be completing activity 11.1 in your textbook, titled, Are You Taking Control of Your Lifestyle to Prevent Cancer? In summary, cancer is a category of diseases that share similar traits, including gene mutation and controlled cell growth. Risk for cancer is influenced by our lifestyle choices. Cancer cells will grow and multiply uncontrollably and ultimately form a small tumor which can either be benign or malignant. Metastasis occurs when cancer cells break away from a malignant tumor and migrate to other parts of the body where they can cause new cancer. The most effective way to protect against cancer is to avoid negative lifestyle habits and behaviors. Dietary fiber, nutrients, and phytonutrients appear to work in synergy to prevent and slow cancer development at various stages. A diet high in processed and red meats correlates with a greater chance for developing cancer, so intake should be minimized greatly to reduce risk. The biggest carcinogenic exposure in the environment is tobacco. Therefore, tobacco use and exposure to secondhand smoke increases your risk for developing cancer. An active lifestyle has been shown to have a protective effect against cancer. Therefore, physical activity is good for preventing the risk of cancer. Many cancers can be controlled or cured through early detection, so periodic screening is crucial.